A Maine woman's mailbox is flooded, not with bills or junk mail, but more than 130 identical letters from the state.
She's a licensed therapist, and the letters came just after she renewed her MaineCare credentials. The I-Team's Dan Lamparello looks into why this happened in tonight's Waste Watch report.
One after another after another.
And it's the same exact letter every time.
All 137 piled high on Brenda Cowette's kitchen counter.
They're in my mailbox so that they had to be positioned like that so that it would fit in, and they had to have rubber bands in them to hold them all in. I don't think there could have been another piece of mail in my mailbox.
At first, she thought it was all junk mail or a glitch at the post office. But after seeing the return address from the Maine Department of Health and Human Services, she knew it was something more official.
So I opened 3 of them because I didn't want to open all 137.
Cowette, a licensed therapist contracted through Child Development Services, says she's been on the lookout for a letter from DHHS after recently applying to renew her credentials to bill through the MaineCare system.
I've done it before and I've only got 1 letter.
And while she did get that approval again, she says she can't understand why it was sent in bulk and the waste that came with it. The stamps alone cost more than $75.
All the same thing over and over for all the postage, all the time spent, all the everything, saying exactly the same things.
After calling DHHS last week and getting no answers.
I know nobody's going to have any accountability or responsibility for this, but could I have a phone call back explaining why I had 137 of these letters exactly the same sent to me?
So Cowette contacted the I-Team, and when we reached out this week, a spokesperson for the agency said they haven't had any other reports like this, telling us in a statement, "We are looking into what might have triggered this duplicative mailing to this provider so that we can prevent it from happening again."
And that's it.
For Cowette, she's happy the situation is being addressed and hopes it will lead to more efficiency.
And I just wish that the system went towards something beneficial. This is not beneficial to anybody.
Now, while DHHS says the multiple mailings in this case seem to be an isolated incident, providers who experienced anything similar should reach out to the agency's Provider Services Division. We have that information on our website. For the I-Team, I'm Dan Lamparello. Marissa?
Dan, thank you.